So inshallah, we're about to start, and we'll go to 7 o'clock. Then there'll be salah, and then there will be food downstairs. You have to wait. So we introduce to you Dr. Muhammad Hatim, and he is going to focus on the topic of communication in the family. And this is a big topic, people. We want to give it attention because this is one of the issues that we hear a lot, especially when we do marital counseling or when we deal with your children. The issue of communication is one in which we find that there's a breakdown in our families. So without any further ado, I present to you Dr. Muhammad Hatim. So here we'll be presenting the PowerPoint that is going to be used. And then at the end, we have a few slides. We'll try to make it a little interactive, right? We'll try to make it a little interactive. And then we have some case studies. Now, I apologize. Let me make this statement really fast. In the case studies, some of the topics are going to be not to the liking of some people, but they are topics which we confront. That doesn't mean that it's going on in our families, but it may be going on, so we should prepare ourselves on how to deal with this. As we say, we deal with the reality at hand. So, again, with no further ado, Dr. Muhammad Hatim.
People who have questions later on.
Okay. So somebody can you hand these out if people have questions?
Assalamu alaikum.
Whoever wants to ask questions but not be vocal. Wa alaikum salam wa rahmatullahi wa barakatuh.
First, I'd like to thank you for inviting me to participate in your family day. I'd like also to ask you to find a peaceful place in yourself, in your heart, in your mind, and prepare yourself for whatever the best that Allah has to offer for you. And in order to get that started, I put up this picture of a beach in St. Croix, the Virgin Islands. And one of the reasons I do is for myself, because it allows me to calm myself and focus, settle my spirit. I imagine myself sitting on the beach underneath this tree, taking in the blue turquoise waters and getting myself ready for even this presentation. So I'm asking you to find whatever your sacred space is, if it's a mountain or forest, if it's a beach, and to go there for a second, calm yourself. I know it's been a busy day, there's a lot of activities going on, but we want you to be open to the best possibility of what Allah has to give you today. So that's why the picture of the palm tree. Can you hear me? That's the topic. Can you hear me? It's exactly why I picked that particular topic. Can you hear me? Yes. The subtopic is authentic communications in the modern world. Authentic communications. By authentic, we mean that there's actual communication that's related to whatever your intention was for saying or asking a particular question. I want to acknowledge the brother here who in my estimation is a gem. This brother, and working with him over the last couple of weeks, I have really understood him to be a dynamic person, a person who is intellectual, but also has a heart as big as all outdoors, and a concern and a love for this community. I just want to acknowledge that. Project outcomes. What I'm interested in having you understand and invite you to use I statements in terms of this particular presentation. One, take responsibility. I take responsibility for how well I communicate with others. I'm asking you to do the same. I obtained the desired result of my communication. I'm asking you to say the same thing, that you, in this particular project, you'll take responsibility for your communication. And when you leave here, that you'll be able to take responsibility for your communication and be able to assess how well you communicate. How well do I communicate? Did I say what I wanted to say? Did I say what I intended to say? Or am I just talking to scream at somebody, or I want my child, bring that, come over here, do this? Is that a communication, authentic communication? These are some of the questions you may want to ask yourself. And then to identify tools and techniques. Inshallah, towards the end, we'll give you some suggestions, but you have life experience. Identify your own tools, the things that you have that have worked for you in terms of communication. In terms of group rules, I always like to go over the rules. People should always be respectful. If someone says something that you disagree with, when you respond, or if you respond, keep it on the I. Instead of, yes, you said this, you said no. You want to keep it on the I and say, well, I have a different opinion. I believe, or I would do it this way. So you want to keep it on the I. One person, of course, speaks at a time. Confidentiality. It's a small community. And we want people to be able to share what's on their minds and share what's on their hearts. So we want whatever is said here today stays here. It's not that you take it out, not that you would gossip, but respect another person's feelings, their understanding, and their experiences. It's their experiences, and it's real to them. Their experiences are real to them, and we want to be able to respect that. So honor whatever is said here. And again, using the I statements. And not to be rude, but there's such a thing called Elmo. That is, if someone is talking and they're just going on, we want them to express their ideas and their hearts. We have a time limitation. So if you hear me say Elmo, that means it's time to move on. Time to move on. No disrespect intended. Again, keeping the I statements, accepting responsibilities, and reducing the anger. Communications. I imagine everybody has an idea of what communications is, so I'm not going to belabor that. But can I ask them? So somebody tell me what you think communications is or is not. Some of the sisters, the brothers, anybody, hands up.
You have a microphone for the sisters back there or no?
No? Is there a microphone for the sisters? Is there a microphone? Okay. For the brothers either? Well, in any event, somebody tell me, what is communication? I mean, we use the word all the time. One person, two. I see a sister's hand. Thank you. Thank you. The sister says that it's communicating an idea, a message in whatever language or a manner that the person uses. Is that correct? Okay. Any other? I saw a brother's hand over here. Yes, sir. Articulate. To be able to articulate a given set of thoughts and ideas. Excellent, excellent. So as you can see from the slide, that communication is multifaceted, multi-layered. There's written communications, verbal communications, sign languages of communication. There are barriers to communications. Somebody says something, and just because somebody says something doesn't mean that the person who heard it understands what was being said. If somebody speaks Chinese, they're talking to somebody who speaks Arabic, and they say, well, why don't you understand what I'm saying? There's a whole language there. So the barrier. So what is received, what you get back, is a part of the authentic communication. Not what you say. It's important what you say, but what you get back from the person. That's what you can. That's why you can tell, how you can tell whether the communication was authentic or not. Okay, sure. Family Muslim communication is going to be okay. It's going to be important in your family that you have open communications and authentic communications are certain about what you're saying. If it's a parent talking to a child, if it's a husband talking to a wife, being open, listening, as opposed to just hearing what's being said as noise in the background, actually listening and responding. I'm going to ask the brother to talk a little bit about communications from an Islamic perspective.
So we can go to the next slide. Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. We're not going to be able to take all of the slides because of the time. Now, something that we had discussed, myself and Dr. Muhammad Hatim, is that we can continue this type of project in other, gatherings, because it's actually there's about 3 or 4 workshops within this. But first, we want to begin with Allah Tabaraka wa Ta'ala is as-Sami', right? And so when we look at the fact that Allah Tabaraka wa Ta'ala hears everything, we should be conscious of the fact that this is an issue that المحاسبة سيكون على أعمالنا وأقوالنا. We before Allah Tabaraka wa Ta'ala, we're going to be accountable for what we say and what we do. And like Dr. Muhammad Hatim said, that what we say is as much communication as what we do is as much communication as what we say, sometimes more so, right? What we do, because sometimes what we say, the people they register, but then they say, but you do this, the opposite of what it is that you say. So that's the first thing, is to be aware of that fact. And let's go to the next slide after that. This here is an important ayah of the Quran. We can't, like I said, we can't cover everything. But this is an asl or a foundation. إذا قرئ القرآن فاستمعوا له. الاستماع هذا طالب السماع. Allah Tabaraka wa Ta'ala in the Quran is commanding us to listen. But here, one of the things about the Quran that is important is that there's a differentiation, a tafriqa bayna al-istima' wal insat. Right? So the issue that we have here is that the Quran is telling us to listen, but the first thing is to pay attention with our ears to the sound. That's one thing, the sound that's coming in. The other thing is to give attention to the meaning. And so that becomes the methodology for us, that most of the time, what happens, even sometimes, I was busy and I haven't seen my mom for a long time. And those of you who know, I was traveling back and forth 4 hours a day before I got an apartment close to here. So I would stay with my mom. So I was trying to organize something with Muslim Family Day. This was not too long ago. So I got a text from somebody about it. And so my mom looked at me and she said, she was talking to me, she said, you're there, but you're not there. You're not listening to me, because she saw me on the phone. And I'm telling her, yeah, I'm listening to you. She said, no, but what she wanted was the attention, right? She wanted the full attention. And so that becomes, this is the Quran is telling us, even with the Quran itself, sometimes we're playing the Quran in the car. Sometimes we have the Quran and we're doing other things, but we're not giving full attention. We're maybe listening, but we don't give full attention. And this is the point, and I'm going to give it back to Dr. Muhammad Hatim. This is the point where a lot of us are failing in our relationships with each other, in our relationships with Allah Tabaraka wa Ta'ala, in our relationships with each other, husband and wife, parents and children, friends, is that we feel like, yes, people are listening, but they're not giving us attention. Really fast before we move on. How many of you agree with that? Raise your hands. How many of you disagree with that? Raise your hands. How many of you refuse to comment? Raise your hands. No, I'm just joking. So we have a good enough amount of people. Let's just take one. Who can say, what do they feel about that? Who's bold enough? We need one from the sisters, one from the brothers. We even got the microphone for you. Thank you to the to the office. Barakallahu fikum. They were not only listening, but they paid attention. From the bottom. Somebody help Dr. Zara, help her with that, please.
Usually, like, oh, I usually tell my kids that we have two ears and one mouth, so we should listen twice as much as we speak.
That's beautiful.
They're still trying to understand that concept. So
That's beautiful.
I feel like it's communication is huge, like a huge topic to talk about, especially with our youth. So this is really good. Like once we're able to talk about our feelings and what's going on in our families, inshallah, we'll be able to be more productive and have like a more deeper understanding of how to deal with situations, especially if there's situations at school or any other aspect of your daily life. You'll be able to communicate it to each other, inshallah.
Thank you for that. One
Thank
from the
you.
brothers. Come on, don't let the sisters outdo you.
We're going to start picking on.
Yeah, I do that. I pick on folks. Right here, brother. Can you have a response? What is let's look at the next slide. Is what is communication? How do you communicate? And what does it mean to you? Not what it is, but what does it mean to you? Communications. To be articulate. All right. How good are your communication skills? Next slide. Assess yourself. Is it good, or it could be better, or what do you think? Could be better. How many people think that their communication skills could be better? All right, that's good. So inshallah, we'll have a good seminar on how to make our communications better in the near future. Okay, one more question. Is there ever a time that you fail to communicate something? Ever? Is there ever a time that you fail to communicate? Yes, no? Most of the time, what? You fail. Okay. So is there ever a time when you don't communicate, or you think that, I didn't communicate? Would you ever say something like that? Yes, no? No. There is never a time that you fail to communicate. Never. If it's by a look, if it's by something you say, if it's something you don't say, you've communicated by the way you dress, the way you turn your head. Young children, the way they roll their eyes. No, you didn't roll your eyes at me like that. They communicated. Or like now, if we're doing something here and somebody's reading or somebody's doing something else, they're not paying attention, that is a communication. It says something to me, it says something to the people who are around. So you never fail to communicate. Different types of communications, quickly, verbal, nonverbal, electronic, visual symbols. Be careful what you say. Be careful what you say, because words have power. Words have power. If you're a parent, you know that. You tell your children, get over here, come here, take this up, pour me a glass of water, clean your room. Words have power. Also, words have the power to hurt, the power to heal. Words have the power to hurt as well as to heal. So we don't usually think about how powerful we are. The Allah gives us that we say something, we speak, we bring it into existence. Kun fayakun. It's there. We speak, we bring it into existence. So words have the power to hurt and the power to heal. This slide is basically to show that there's different levels and different directions of communications. A vertical communication, meaning that you're a parent, you're talking to your child, upward talking to your parent, your boss talking to you as an employee, you talking to your boss. So it's communication is often vertical. Horizontal communication is like I'm talking to my brother here. He's not above me, below me. He's my peer. So it's more of a horizontal kind of communication.
Is that point clear to everybody or no? Yes? Clear?
No, we want to check, because why? Because that's part of communication. if I'm not clear, then you need to tell me, and I'll have to read it through your body language, because you don't fail to communicate. Even if you communicate that you didn't understand, that's still a form of communication. Look at these words here. Words are powerful. You disgust me. Or you are amazing. Amazing. You're brilliant and kind. Or get lost. So that words have power. Be careful what you say. We want to. Okay. Words of power. Okay.
Yeah, this is a point that we need to focus on really fast. Let me ask a question. Somebody answer this. We don't have a lot of time. So, what usually happens when parents they get mad at their children? What do? How do they make dua? Huh? Explain that one. Huh? Oh, that's a nice one, though. I mean, it has double meaning, but it's double meaning. What's it? Anybody from the back? No, come on. لازم أن أكون صريح بهذا. نكون صريح. You're being nice. Come on. We almost got you. Come on. We almost finished the sale. Come on. Oh, now we have. Well, that's a nice one. What does that mean? Bad words like curse words? But that's come here. This is my buddy. He always participates. Come up here. This is my friend. He always comes through. He always helps me. Oh, no, you go back.
Say astaghfirullah and a'udhu billahi minash shaitanir rajim.
MashaAllah. You have a good Baba, MashaAllah alayk. Allahu Akbar. I pause on this because this is important. Because the amount of damage, we still, let's not, why aren't we sarih about this? What do? We send our children to the Jahim. You know what I'm saying? That's maybe the least of what's being said. But the level of impact, because now you're not only talking down to your child, you're also calling on Allah Ta'ala to get what you want, be a Jabriyan. I'll call Allah on you. You know what I'm saying? And this is an issue that when we talk to the youth, not all of them, but some of them, they bring it up because it hurts them to a level that you don't understand. Sure, it may hurt you what they're doing, but it hurts them to a level, right, that we always don't understand. And we're bringing in the religion into it, and also we're bringing in force, and so we're not giving them a space. Go ahead.
Listening. We're talking now about what it means to listen. The slide has the brother who is doing something. We should all know what that is. Calling the adhan. Brother mentioned earlier that some people, when the adhan is called, we have guidance on what to do when it's called. However, when it's being called, people are busy talking and doing some other things. They're finishing some kind of conversation and being distracted, so that they hear the adhan, but they're not listening. The instruction is to listen to the listening. And there's a difference between listening and hearing. Hearing, it says, is accidental, involuntary, and effortless. We heard the dog bark. We're not listening to the dog bark necessarily, unless the dog is warning us that there may be a burglar, or there's music playing in the background, or I'm working, I'm cooking, and I have sound going on, the radio. I'm not listening, I'm hearing. Listening is focused. It's voluntary and intentional. Very quickly, this effective communication on this slide, we see that there's a S, that's the sender, the R is the person who's receiving, and the message comes out from the sender and goes to the person who receives it. The question is, what happens when the receiver responds? If they don't respond in the way that you want to, a couple things could happen. You could become angry. Don't you hear me? Aren't you paying attention? So who's I don't want to call it the fault, but what's the issue there? Maybe, perhaps I'm not expressing myself in the best way to get the desired result. So I need to do something. I need to go into myself and say, Muhammad, what's happening? Perhaps you need to say it a different way. Perhaps you need to have another approach. So that there are barriers to communication, language, culture, and sometimes attitude. This issue of active listening. Active listening, if we had more time, we could spend more time on what it means to be active listening. Active listening means like to be engaged. I'm hearing, I'm looking at him. It's intentional. And I know that he's listening to me because he's moving his hands. He's nodding his head. So that's active listening. Non-active listening, you're talking to your child and eyes all over the place, listening, and you want to slap them. You don't, because it's against the law. But you're feeling the anger comes up because they're not actively listening. They're not engaged. So you want to be more engaged in active listening.
I wanted to add on this point really fast. We have 6:30. This is the number one issue between husband and wife. Agree or don't agree. Those who agree, speak, raise your hands. Let's see what let's see. Let's do it istiftah. It's okay, nobody's good. Everybody's scared on this one. Okay. This is like the scholars in Islamic fiqh, they say yani al-samt, yani al-muwafaqa. We don't agree with that 100%, but here's this, we agree. So that's the point is husband and wife, most of the time, they want to hear each other, they want to understand each other, but they're talking across each other. And I have something that I call it like the glass wall concept. The glass wall concept is that I'm here before. You see what I'm saying? It's like I'm behind a glass wall. I'm there with you. I want you to understand me, but no matter what I do or say, it doesn't reach because there's a glass wall between us. Right? And so at some point in time, there should be agreement between husband and wife that we know this is going to take place. What? That we're going to misunderstand each other. So we should check back with each other, right? Did I understand you correctly? Or I know that you were mad for a second. I'll give you your space. Or I know that you need to go to your room for a day or 2 days, but not 3 days beyond that. Or I know that you need to go to your mother's house or what, what we do, how we do. But if we don't agree that we're miscommunicating and that we need to give each other attention, then we're never going to have a family, because at the end of the day, what happens at the end of the day? America. Nobody else is helping me, so I have to call on my supporters and friends. If nothing happens, that's good. Not compared to what I'm thinking. Fighting, divorce, whatever else that comes from that. On the principle of what? If we take anything away, on the principle of miscommunication, if we take anything away, it should be this: that we should agree to try to understand each other. We should agree to give each other some time to try to understand each other. Because if we don't, then we're never going to get at a point where we can feel understood, and it's just going to be a fight.
Assalamu alaikum. A couple more points, and then we want to get to some case studies to look at that. One is that there's such a thing as emotional intelligence. Emotional intelligence. We usually think of intelligence as something in the head. He's smart. That's intelligence. But there's emotional intelligence. How do I know? Oh, I feel it in my gut. I feel it in my stomach. I feel the pain. Oh, I feel that person's pain. They're suffering. I feel it in my back. I can feel it. I can sense it. That's the emotion that's having intelligence. It's not thinking necessarily. Mind-centered intelligence is academic knowledge, math, history, using the five senses. Emotional intelligence is the ability to motivate yourself, to process emotions in the face of frustration. I'm about to lose my mind. This person is getting on my nerves. That's not an intelligent thing to do. That's like, I need to check my emotions. So there's a range of emotions, of things that I can do, alternatives. So that linear thought there, linear emotion is something I need to check out. So there is such a thing as emotional intelligence. Just want you to be aware of that. Did they? Oh. So does that make sense? Emotional intelligence? How many people can now tell the difference between intelligence from the brain and intelligence from the heart, let's say? Show of hands, if it makes sense. I don't see any sisters' hands over there. Does that mean you're missing it, or you got it? You got it? Okay. You're just not raising your hand, right? That's all right. Does somebody want to make a comment?
Yeah, this. Keep going. To the slide, yeah. Yeah, and that brings us right into the slide. Here, Allah Tabaraka wa Ta'ala is telling us, sorry, because I don't have my reading glasses with me. But Allah Tabaraka wa Ta'ala here is telling us, yani, fasiru fil ard, right? Go throughout the earth. And then Allah Tabaraka wa Ta'ala is telling us, فَتَكُونْ لَهُمْ قُلُوبٌ يَعْقِلُونَ بِهَا. This is an important point that, first of all, Allah Tabaraka wa Ta'ala is telling us that we have hearts. Here, this is the difference between like Greek culture, right? Greek culture and what they call Semitic culture or Eastern cultures or whatever from that regard. But it's especially a Quranic idea that we understand by our hearts. Our hearts is not just by our brains. And in this culture, right? And in this culture especially, how many of you are familiar with al-hadatha, modernity? Modernity, the philosophy of modernity. How many of you studied Cartesian coordinates? Cartesian coordinates and math. Descartes is, anyway, to be simple about it, was one of the main philosophers that influenced this way of civilization. Okay, in medicine, we have the example. In medicine, what's the focus on medicine? That's the real focus on medicine. But in Western medicine, it's not prevention. But sometimes is there a disconnect between the mind and the body in medicine? They just focus on the body on the other side, right? What about from spirituality? Now it's becoming acceptable to pray, right? Before it's not scientific, right? What about the issue of like emotions, and it doesn't come in, right? Now things are changing, but this society, we have to realize, it puts a lot of focus on up here. That's why we're having all kinds of issues with our emotions. But here in the ayah of the Quran, it's telling us that the heart is the seat. Can you go back to that slide? It's telling us that the heart is the seat of intelligence. And then here, Allah Tabaraka wa Ta'ala is telling us that we have ears to listen. And we have eyes. And it's telling us that in this case, these eyes don't see. People are not listening. They're not seeing. Right? And then so Allah Tabaraka wa Ta'ala is telling us, to come back to see with our hearts. And that's what we want to awaken here. What we want to say is that, look, it's not enough that we're just listening to people, but we have to hear them. It's not enough that we understand their ideas, but we also have to connect with them here, right? That's the important point. Everybody, we're good with that point? Because that takes a lot of time. With our children, with our families, it takes a lot of time. It's not just something that you do in 5 minutes. You have to make time out in order to do that. You see what I mean? So 15-hour workday is not going to cut it. Being on the cell phone all the time is not going to cut it. Being in front of the TV all the time is not going to cut it. Going to your, to parties and so on and so forth, and you go to work, go to party, it's not going to cut it. We have to give each other the time in order to connect.
The slide that's up now is a silhouette of a couple. And this is nonverbal communication. Perhaps everyone who sees this knows what's going on here. Depends on interpretation. If we look, there's a position, the guy is a little bit bigger than the female is, so he's intimidating. However, she has her hands close to, like she's getting ready to claw at him. So she's now being protective. So there's something wrong with this communication. And this is one of when we get to the case studies, we want to be able to get from you what you think, what's going on here. People who are Peanuts fans will see. Is this an authentic communication? People screaming and hollering? Is that an authentic communication? Words can stick to your mind. You will probably never remember words you say in the heat of anger. But to the person receiving them, they might stay with them forever. Last one, again, this child in its heart knows it needs to protect itself from the mother. And so it wants to, it's hearing all the stuff that's in the environment, and the mother is screaming, she's upset. The child knows to protect himself. I need to put my hands over my ears so that I can collect myself and find some peace. So that, is this an authentic form of communication? We want to go to, which case study you want to do first?
Yeah, this picture is an important picture. Why? Because a lot of times we are depending on the mothers to take care of the children, but what happens to the mothers after a certain period of time? Come on, this is the time that you speak out for women's liberation. Huh? Yep. Mothers get burnt out. And then what begins to happen when they get burnt out is what happens with the kids when the mom is burnt out. Yeah, there's just pure frustration. And this is the issue that a lot of us, we don't want to confront. I want to take like 1 minute on this issue. Right now, is it natural that it's just the mother and the father and the children? Is that natural in the family? Is that natural? Who said the nuclear family? Hola, ¿cómo estás? Llegaste. Yes, the nuclear. Now, the nuclear family is not normal. Why? Because this is one of the issues that we have. If you have, for the family, we never understood the family like that. We understood the family in the context of what is shrub, what is qaba'il, and all of this type of stuff, right? So if you put so much pressure on, like if this table only had 2 legs, and I put the pressure on this table with only 2 legs, can the table stand? So the same thing with the issue of the husband and the wife. This is why there's so much pressure. There's no time to get, okay, let's spend time with each other. Or we can't spend time with each other because we have to prepare for school, or we have to take care of the baby, we have to do this, we have to do that, right? So then at the same time, what happens? The father is out working, the mother may be working too and taking care of the kids or whatever. But when the mom gets burnt out, what happens in the household for the kids and the fathers and the husband? The women are not speaking up for each other. What happens? Nothing. What happens in the family when the woman is burnt out? Nobody wants to speak on this issue. Okay? It falls apart. Come on.
I think it's just that the women, we take it lightly, we can't really speak up for ourselves. So what happens is,
So you're going to speak up for the sisters, mashallah alayki.
I'll speak for all of them, okay? So what happens is, the husband is working like tremendous amount of hours outside of the house, and we as women have to take care of the kids, pick them up, make sure their breakfast is done, all of that stuff. And at a certain point, we get burnt out, and we need like 2 3 days to recover. And then like it sort of like goes into this routine, so it's just like hard to make a balance. But it's important for a husband as well as a wife, like if he sees like she needs a break, he has to give her a break, and like something like that.
Yeah, I'm a firm. We have to move on, but I'm a firm believer. And anybody that knows me knows I'm always calling to the issue of the jama'ah in the community, because it's impossible. Some families, it's not that they have their mother and their father and their cousins are going to come and pick up the kids and so on. Some families, they may have that and the family won't help them. Or some families, it's just husband and wife and they're by themselves and they don't take a break from anything, period. They don't have anybody to help them. And when it gets to that point, you know, and I'm going to be open, there's not, I'm going to say something that is, maybe those who have children, you got to explain it to your children. But we had 50 suicides in Texas in a Muslim community. I know one Palestinian family in Ohio. I know the family really close because they like adopted me. There was like 2 suicides in the family. Because people are not listening to each other, and also people are breaking, especially the moms. The case that took place in Texas, Sheikh Yasser Birjaz was talking about that, and the mom, she was just at the end of her rope. She is serious, right? So when we don't also, and sisters, this is why we say, there's a time that you speak up for yourself in a healthy way, versus later on say, but I told you so, right? Versus the screaming. Because this is what we see with the image that was there. That the mom comes to the end of her rope and then she's just screaming at everybody. We already know, we beat the brothers up all the time. We know that we know that we have our issues that we have to correct. But we want to get as to why it is that some of the sisters, they're at a point where they feel out of control. Because you can't do it alone. You see what I'm saying? So if you can't do it alone and the situation is hard, now we have to learn how we're going to tone down. That's the importance of the masjid. Everything can't just be online. The importance of the masjid is that you have other people to help you in the process. You have a sister that you can trust, that you know how she functions, that maybe she can watch the kids, and maybe your husband and you take a break, or maybe you take a break. But if it's just you by yourself, and I'm speaking specifically to the sisters, and you're carrying the weight of the whole of the dunya, you're carrying the weight of your family in Palestine, and what your husband said yesterday, and your sister was gossiping, and what somebody said on Facebook, and the kids, and this and that. After a certain period of time, it's not going to be possible that you're going to keep it all together. So let's go to the case study. No, go ahead. Let's go to the case study, and we would like, participation on this issue.
In the time that's left, we're going to briefly talk at some of the case studies. What I'm sensing is that there may be a need for separate discussions, one with the men on communications, among men, communications with their wives and children, a separate one with the sisters.
Who agrees to that? Raise your hand.
On communications and what it means, and what is an authentic communication, how to express yourself, things to say, things not to say, things to being able to listen, the act of listening. So those are separate issues. I know this whole general conversation is on communication. It can be broken into maybe 10 or 15 different levels. Each one is important. So over the next 5 or 6 months or whatever it is, or every other month, we can have some discussion, and even with the youth, and bringing the youth together to talk about the issues that are theirs in terms of a safe space. So that's good. And I'm always talking when I go to the different messages, to have a safe space for the children and young people, not just the children, but the young people, 12 to 15 or 20, whatever, where they can come and talk about their own issues, facilitated by someone who understands and will keep the confidentiality, someone who can work with them. This particular case study, I'll go through it quickly. Sophia is 28 years old. She recently received a cancer diagnosis. She has 2 children, ages 3 and 5. She's a stay-at-home mom. She's pregnant with a 3rd child. The doctor informs Sophia that she should begin medications and radiation treatment for the cancer. The shock of the news causes sadness and some anxiety and anger and fear. So you as a husband, you as a brother, you as a child, you as a sister, auntie, how would you deal with this? What are the important issues in terms of communication? How would you communicate? This is open. Help me. Give me some feedback here. Let's see the brother here. Is there a mic? Is there a mic? Be loud. Okay. Yeah. So, okay, you got compassion, you got understanding. What do you say? This is what it is. See, this is the communication. She can feel your compassion. What do you say? How would you approach it? Yes, sir. Okay. Brother said take action by helping. Come on, sisters. This is about a sister, Sophia. She just got a cancer diagnosis. What are you gonna say to her? How are you gonna help her? How are you gonna communicate?
I'm here for you. Tell me what you need. Do
There
you
you
need
go.
me to go grocery shopping? Do you
That's
need
right.
to take care of the kids?
Right.
Give her support, but by something that help her in the everyday lives.
Excellent. We're going to go to the next one. We could spend the whole session just on somebody with a cancer diagnosis and things to say. Ayub, he's a 20-year-old college student, lives at home with his mother and father. He's been stealing his elderly father's pain medication and has become dependent on Percocets. A lot of people taking Percocets for pain and other kinds of medication. And some people becoming addicted of it. Here we have a young man who's stealing his father's medication. Okay. He's dependent now. He's embarrassed and ashamed to tell his family. He won't even show up at the masjid anymore because he's afraid that people might tell that he's been taking the drugs. And he's thinking about buying street heroin. That's the tradition now, or practice. When somebody can't afford any longer the pain medication or the doctors stop giving them the prescription, then they'll go to the street for the street heroin to take the place of the Percocet. Real case, happens all the time. I know this, that's all I'll say about that. And I know that, that's all I'll say about that.
People may not feel comfortable with that one. So just kind of throw some interventions out. How do we deal with that?
One of the things you might want to do is have a conversation with the person without being judgmental. You know, you want to find out where they are. You deal with them where you find them. Come on, brother, what's going on? Come on, sister, what's happening? Talk to me. Then the next thing you may want to do is to yes, ma'am.
She was saying, take them to the doctor.
Take them to the doctor. That's right. Either make a referral, take them by the hand to the doctor, take them to the treatment program.
I want to say something about this one. My mom recently was telling me that in her job is known because her job is like a small business. So they all know each other for years. She's been working there like 40 years. And so she was telling me that one of the co-workers, his son, and they come from a rich family that is not Muslim, a European American family. And she was telling me that her co-worker's son is hooked on drugs, like really bad. And she was saying that it has caused a division in the family between the husband and the wife. And so she was saying it's so bad because it's in Philadelphia. So she was saying that sometimes the father will take the son to an area of Philadelphia where it's known that they sell drugs so he can get his fix because this is out of control. And then he'll wait for him. And then she said that sometimes when they get mad at him, they kick him out. So he either sleeps in the garage or sometimes he sleeps in the car. And so my mom was telling me that he said to her, she was asking him, how are you doing, this, that? And she said to him, life is not worth living. Right? Life is not worth living. The point of saying this is that to you as a parent, not anybody here, we're not singling out anybody here, but when we give advice, you need to get support too. Because that situation is a situation which is not normal. You see what I'm saying? And it could be you, it could be your wife, it could be your children, it could be anyone. It's just like a brother when I was in Imam in Cleveland. He was telling me after the salah, he was crying. He asked me to talk to him. He says, my father drinks. Then he meant Ahl Philistine, Ordoni. So he says, my father drinks, and I told him that his salah is not accepted. I told him, Akhi, I got mad at him. I told him, Akhi, why would you tell your father that his salah is not accepted? The issue that, okay, fine, you may have that in the deen, ilman, lakin min nahiyat al-tarbawi, yani min nahiyat al-tarbiyah. How is it that you're dealing with the person as far as educated? If they're coming to Allah, they have that problem, why are you blocking them? So then I asked him, I said, look, something happened to your father because that's not natural. Yani, ليست من طبيعة المسلم أن يشرب الخمر. So what happened? So he said, my father saw his brother get killed in Philistine. And after that, he was never the same. You see the issue? So when we start dealing with this issue like drugs and all of this type of stuff, sometimes we ourselves don't know how to handle it. Or sometimes we ourselves are trying to handle it, but we need to find our support ourselves, or else we become like that person, right?
Again, there's a possibility of doing a separate discussion on alcohol and drug. At some other point. Just want to. There's a possibility of doing some workshops on alcohol and drug, alcohol, mental health. That's an area that I'm very familiar with, so that inshallah in the future is possible. We want to look at this third case. Kareem is 50-year-old male. He's married, 3 children. He's addicted to pornography. He spends most of his free time in his man cave, working and viewing pornography. His wife, teenage children are concerned about him. His behavior is affecting the marriage and the relationship with his children. What do you say to him? How do you say it? What are the issues here? Yes.
Give us a response to that. Since you're not from the community, it's easier to talk on the issue.
Okay.
I imagine that the person should know.
Is there a mic?
Again, I can speak without a mic.
Right.
I imagine that the person should know that this is a pandemic, right?
Yes.
This is something which has become, rather widespread amongst various communities.
Yes.
That multiple communities are trying to deal with this.
Mm-hmm.
I mean, I believe that there's certain Christian communities that have even come up with ways of trying to self-surveil, right, or to create a bond between people that already have a tremendous bond, where they connect themselves to an app. That if ever this happens, automatically that group all knows about it.
Yes.
So attempting to self-surveil. So again, I would imagine letting them know that they are not alone in this. That this is a pandemic.
Yes.
Right. This is a pandemic that spreads, from the married to the unmarried. That has even reached, children in the United States.
That's right.
And that there are many avenues of trying to check oneself and to deal with this, not by oneself,
Yes.
but with the community or with people that one feels secure with.
Yeah, and thank you for that. And in summary, we were talking about getting help for the person, being able to make a referral. And the person who's doing it, knowing that they need help, one, and then accepting the help. Because one thing to know that you need help, another thing to actually reach out for the help. And it is for the loved ones, the husband, wife, children, whoever, to encourage the person to get some help. Sometimes they can't do it by themselves. And they can't necessarily pray it away. They have the intention, and however, they don't have the tools to do it. This last case, Aisha is 15 years old. She recently announced to her family that she thinks she is homosexual. She's had a brief encounter with one of her schoolmates and is unsure of herself. She's feeling sad and is considering suicide. Because of the embarrassment and the shame and the guilt and the rejection, possible rejection from her community, her solution right now is to commit suicide. So what do you do in a case like that? You're all shocked, right?
So, with the issue of suicide, there's three things. One is a person is talking about it. The other thing is a person, yani yuhattat, is making a plan. We clear? The third thing is when the people they actually attempt. So in this case, you have to seek help. We have to cut right now for salah. But the issue here is that this is something beyond you, and you have to seek help, inshallah. That's why we said some of the case studies are a little difficult, but they're about our ability to communicate what it is that we're going through and to come up with some solutions, right? Come up with some solutions.
So in summary, in the beginning, I said there were a couple of things we wanted to leave you with and invite you. So again, at the end, I'll keep it on the eye. Let me take a step back and ask myself first, am I aware that I'm communicating every moment with others? Second, am I aware how I'm communicating? And the third, am I making sense and saying what I want to communicate? So these are the things we want to leave you with. I want to thank you for listening and your patience and your love and attention. I'll pass it to the brother.
So after this, we're going to pray, and then we're going to eat, and then there'll be another workshop on the issue of social media. Then after that, there'll be a lecture, and then we wrap it up, right? Abu Murad.
السلام عليكم. الآن صلاة العشاء، وبعدين العشاء downstairs على الفيرست فلور for everybody إن شاء الله. السلام عليكم. خليه شوف وراك.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله الله أكبر الله أكبر. أشهد أن لا إله إلا الله. أشهد أن محمدا رسول الله. حي على الصلاة حي على الفلاح. قد قامت الصلاة قد قامت الصلاة. الله أكبر الله أكبر. لا إله إلا الله.
استوى. الله أكبر. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. يا أيها الذين آمنوا إن تطيعوا فريقا من الذين أوتوا الكتاب يردوكم بعد إيمانكم كافرين. وكيف تكفرون وأنتم تتلى عليكم آيات الله وفيكم رسوله ومن يعتصم بالله فقد هدي إلى صراط مستقيم. يا أيها الذين آمنوا اتقوا الله حق تقاته ولا تموتن إلا وأنتم مسلمون واعتصموا بحبل الله جميعا ولا تفرقوا واذكروا نعمة الله عليكم إذ كنتم أعداء فألف بين قلوبكم فأصبحتم بنعمته إخوانا وكنتم على شفا حفرة من النار فأنقذكم منها كذلك يبين الله لكم آياته لعلكم تهتدون. ولتكن منكم أمة يدعون إلى الخير ويأمرون بالمعروف وينهون عن المنكر وأولئك هم المفلحون. الله سمع الله لمن حمده. الله الله أكبر. الله أكبر. الله أكبر. بسم الله. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. ولتكن منكم أمة يدعون إلى الخير ويأمرون بالمعروف وينهون عن المنكر وأولئك هم المفلحون. ولا تكونوا كالذين تفرقوا واختلفوا من بعد ما جاءهم البينات وأولئك لهم عذاب عظيم. يوم تبيض وجوه وتسود وجوه فأما الذين اسودت وجوههم أكفرتم بعد إيمانكم فذوقوا العذاب بما كنتم تكفرون. وأما الذين ابيضت وجوههم ففي رحمة الله هم فيها خالدون. تلك آيات الله نتلوها عليك بالحق وما الله يريد ظلما للعالمين. الله سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. صراط الله أكبر. سمع الله لمن حمده. الله الله أكبر. الله أكبر. الله أكبر. بسم الله الرحمن الرحيم. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام عليكم ورحمة الله. السلام عليكم ورحمة الله.
Assalamu alaikum. Before everybody goes down, a small announcement. Our annual Umrah trip is confirmed. It will be from January 31st to February 12th. It will be for 11, 12 days. There will be one prayer in Mecca, a Jum'ah, or one Jum'ah in Medina, inshallah. If, the seats are limited, so whoever is interested, please register, see the office, register your name, book your reservation before it's too late.